The chair recognizes the gentleman from Arizona, Mr. Schweikert, for 30 minutes.
Thank you, Speaker Pro Tem. And to my friend from Texas, your intro was actually brilliant, because we're going to try to do something this evening that is going to make a whole bunch of people really cranky. And that is, we're going to talk about, Mr. Speaker, let's see if I can frame this in a way that I don't sound too much like a jerk. Week after week after week after week, I've come to the floor here and walked people through saying, okay, you know, the blue here, that's portion we get to vote on. And that every dime a member of Congress votes on is on borrowed money. This is all borrowed, plus actually a portion of your Medicare, if you look at the math, is actually borrowed. And interest this year gross interest is going to be $1.2 trillion. Making interest the second biggest expense in this government. But one of the arguments I've come over and over and over is trying to find moral, effective ways that we can save ourselves. That you could actually impact this remarkable amount of debt where we're hovering around borrowing about $100,000 a second, every second of every day. We're just a little below that. And then the really uncomfortable is when you walk through the data, it's interest and healthcare. And I'm not a doctor. I'm good at math. The dear Lord gave me sort of one thing. I'm good at math. But I thought I'd try something new and exciting. How about if I brought my friend who just happens to be benefited with a medical school education? That's why we'll call you Dr. Harris, and talk about if healthcare is the primary driver of U.S. sovereign debt, why not engage in the morality of a society that's healthier, that could be more vibrant? And I've come here and we've talked about diabetes being 33% of all U.S. healthcare, being 30% of Medicare spending, the cascade of conditions that come from obesity in America, and the fact that the morality of loving our brothers and sisters and having a healthier society. And my economists, right now, we're working on our reply to the president's budget, and this is a rough, we're vetting all the math and we're highlighting things, but a preliminary view, and we're still about 2 more weeks from our publication. We estimate that obesity will result in anywhere between 8.2 and 9.1 trillion in excess medical expenditures over the next decade. Maybe the most powerful thing you and I could do for U.S. sovereign debt and burying your retirement and our children, our great-grandchildren, our great-great-grandchildren in piles of debt would actually be working on policies to make us a healthier society. You get the benefits of the morality and really good math. And I just happen to have a medical doctor who's a member of Congress, who's on the Appropriations Committee, who has an expertise that I don't have and can talk about things that I can't say. But understand, we mean this from a portion of optimism. There is a path here, but we got to do something that's brutally uncomfortable for us. We got to tell the truth. Is that a fair setup?
Well, I want to thank the gentleman from Arizona for yielding some time today. The gentleman, if you to those who see the gentleman virtually every week come up here and talk about the economics of the United States and our debt problems and things like that, today we're going to take a little different view, because we're going to talk about something that doesn't just have to do with economics. It has to do with providing a healthier America. An America where, yes, we would save money if we were healthier, But the other benefits are so tremendous. We're not doing this just because we want to save money. We're doing this because we think this is actually the right approach for Americans. And there are a couple of diseases. If you look at the cost of health care, about 70% is to take care of chronic diseases. And the big chronic diseases are hypertension, diabetes, and obesity. They're the big chronic diseases. You know, cancer is not a chronic, it's an acute disease. It's the chronic diseases that are costing literally hundreds of billions of dollars to the United States. So it would help, and today we're going to focus on obesity. Now, hopefully in the future we'll focus on diabetes, maybe on hypertension, but obesity, and the reason why it's so important to start with these three is that the amount of spending, as the gentleman indicates, is tremendous. I mean, the last time, and I'm going to pull some data from this study from the Milken Institute. It's called America's Obesity Crisis. It was from 2018, so it's 5.5 years ago, October 2018. But it's subtitled "The Health and Economic Costs of Excess Weight." The health and economic costs, because they're both costs. Again, it's not just dollars and cents. They count, but the fact of life is just not as good for someone who has a chronic disease. So let's do something to prevent it. But the first thing you have to do is you have to say, okay, well, what's the history of obesity in the United States? Because I think if people look around and people are honest, they go, well, yeah, look, I've been on this earth 67 years. I will tell you it's been noticeable that more Americans, and it's true throughout the world, but concentrate on America, more Americans are obese or overweight. And these are medical definitions. If you are higher than the normal range of weight, you are overweight if you're slightly higher, and then you're obese if you're higher than that, and then severe obesity if you're, or we used to call it morbidly obese as well. But the interesting thing is, back in using these definitions, the same definitions, in 1962, 3.4% of adults were considered obese. 3.4%. So that's, again, it's not overweight, it's obese. It's more than overweight, it's obese. In 2000, so from 1962, 3.4%, in 2000, 30.5%. In 2016, 39.8%. So 8 years ago, 39.8%. And the latest data the CDC has, which is from 2017 to 2020, 41.9%. 41.9% of Americans classified as obese. Now, why is that classification important? By the way, the demographic breakdown is very interesting, because as we go to say, what we ought to be doing is we ought to be looking at the demographics and paying attention to where it exists in the population. 49.9% of black adults are obese, 45.6% of Hispanic adults, 41.4% of white adults, 16.1% of Asian adults. So it actually is overrepresented in the black and Hispanic communities. But why is that important? And oh, by the way, children, that's adults. The striking thing is for children in the last year that we have data, 16.1% overweight, 19.3% obese. 1 in 5 children are considered obese. 1 in 16, 6.1% severe obesity in children. And again, that severe obesity in children number is actually higher at 6.1% than the entire adult population back in 1962. But it begs the question, so why is it so important that we identify obesity? It's because I think a lot of people don't understand the broad range of diseases, including expensive healthcare diseases, in which the risk of that disease is higher if you are obese. Now, it's not everybody who's obese has these problems, but if you're obese, you're statistically more likely to have these problems. And I just want to read the list so you understand why this is such a large economic problem. Alzheimer's and vascular dementia. Most people don't realize obesity is a risk factor for that. And we worry a lot about that because the cost of Alzheimer's in America and the treatment is measured in, the hundreds of billions of dollars. Asthma and COPD, breast cancer. We know that cancers are chronic back pain, colorectal cancer, congestive heart failure, again, a large consumer of healthcare dollars, coronary artery disease, diabetes, of course, but And again, diabetes and obesity kind of go hand in hand, but only 20% of the cost of obesity, again, the approximately $1.7 trillion annual cost back in 2016, only 20% of that can be attributed to the coexistence of diabetes and obesity. So again, diabetes has to be handled by itself. Obesity a risk factor for it. Dyslipidemia, so people with high cholesterol and lipids, end-stage renal disease, endometrial cancer, esophageal adenocarcinoma, gallbladder cancer, gallbladder disease, gastric cardiac adenocarcinoma, so stomach cancer, hypertension, liver cancer, osteoarthritis, ovarian cancer, pancreatic cancer, prostate cancer, renal cancer, and stroke. All of these have a higher incidence in someone with obesity. So scientifically, they say, okay, if we can reduce obesity, we'll reduce the incidence of all these diseases and the costs associated with them. And the costs associated with them attributable to obesity is over $1.5 trillion a year. Both direct costs, the cost to actually treat someone, and the indirect costs, the cost of decreased productivity and decreased contribution to the GDP and the economy by someone who is ill. So always indirect and direct costs. But these numbers are just staggering.
And yet, I promise you, tomorrow we'll have things on our phone attacking us for telling the truth. Mr. Speaker, I'm going to argue our willingness to come here and tell the truth. I love people. I want them to flourish. I want you... Look, we're about to have, We're about to have our 5th year of prime-age males. Their life expectancy is shorter. You were actually walking me through some of the math earlier. Does anyone care? The concentration I see of the lack of family formation, of the productivity, the ability to participate in society, the healthcare costs. What would happen if instead of having a society where we were afraid to talk about it, the stigma, but we're saying there are policies, and I have the stacks of charts and these things, but there are policies we can engage in to make a difference. Look, this is on topic and uncomfortable, but one of the things I've come here and over talked about, let's just use this chart down here. Medicare is singularly our primary driver of our debt. It's healthcare costs, but it's an earned benefit. You paid your 40 quarters for Social Security, you paid in, but the average couple will have paid in $227,000 in FICA taxes, that portion that goes towards Medicare. But they get back $725,000. That differential right there is the primary driver of U.S. sovereign debt. Do you do what some of the folks around here want to do, my Democrat colleagues, where they want to basically say Medicare for all, we're going to ration it, it's going to be government, everything from the doctors you have are going to be government employees, that sort of model? Or should we actually take on something much more moral, much more creative, and much more, actually, I would argue, doable? Let's actually look at the government policies we engage in where we functionally subsidize people's misery. Could we actually turn some of the very programs we have and make them more moral and help make our society healthier? And Doc, I know that's been one of your fixations. You've been in front of committees over and over and over talking about things we could do, everything from agricultural legislation, nutrition legislation, the things I do in Ways and Means of trying to finance access to therapies to make people healthier.
Sure. So just today, in my subcommittee, I chair the subcommittee on agriculture on the Appropriations Committee, and we're in charge of funding the Supplemental Nutrition Assistance Program, SNAP program. Now, if you were paying attention about an hour and a half ago, the folks from the other side of the aisle, all they want to do is look, let's just push more money into the Supplemental Nutrition Assistance Program. Now, the second word there, by the way, is nutrition. That program was founded, if you go back to the original founding, the program was founded to provide nutrition. Now, in the early days of the program, there were a significant number of people in the country who actually did not receive enough calories. Like, literally, they didn't receive enough calories. So at that time, it was, the emphasis was, okay, let's get food of all kinds to these folks so that they're not calorie starved. But what we see from the trend, again, I talked about the trend in obesity. Something is happening. And you have programs like the Supplemental Nutrition Assistance Program, where the last time they looked at it was in 2016, where it might have been earlier actually than that, where 10% of the funds, now remember, this is a $122 billion a year program, taxpayer dollars. We ask taxpayers to pony up or to borrow $122 billion to put into the Supplemental Nutrition Assistance Program. 10% is on sugary soda. 10%, $12 billion, our best estimate, spent on something that we now know. Maybe 40, 50 years ago, when the obesity rate was 6%, we didn't know that, or 3+%. But we do know now what contributes to obesity. We do know that insulin resistance, the presence of sugars and processed foods in the diet directly cause obesity. And of course, diabetes, which again we'll get to in the future, and probably also hypertension to some extent. These are all interrelated diseases. But we actually know that that's bad. And I've proposed just saying, look, let's just take out non-nutritious food. It's about 20%. It's 10% sugary soda beverages, another 10% salty snacks. Ultra-processed food, again, raises your insulin levels, does all the bad things that ultimately lead to increased amount of fatty tissue and obesity. So let's just say, well, yeah, we'll allow states to restrict that in a program and take that money and spend it on fruits and vegetables or something, right? Now, that sounds like a pretty novel idea. Sounds like a pretty good idea based on the scientific evidence. And the pushback has been tremendous, mainly from the other side of the aisle, which is, no, all we need to do is spend more money on this program. Well, I would suggest to the gentleman from Arizona, and to people who are watching, and Mr. Speaker, we have enough proof that what we've been doing hasn't been working. In fact, it's been making the problem worse, because the data on people who receive Supplemental Nutrition Assistance Program is they are more obese and more overweight.
And sicker.
And of course sicker, because we know these diseases relate to them, than individuals. But the studies were done against individuals who had the same socioeconomic status, same income, but were not getting SNAP benefits.
But Doctor, the argument here, the morality argument I really want us to make is the way we've designed these programs. They originally, as they were designed decades and decades and decades ago, we now understand we're financing people's misery instead of financing the opportunity to be healthier, to be part of society, to actually live longer. It's uncomfortable, but we have to have a moment of honesty. And I don't understand the left's fixation on basically using borrowed money to finance misery.
Look, I agree. This is not just about economics. It's using borrowed money to actually cause the need for more borrowed money in the future.
On the economic side, we call it knockoff effects, second degree, third degree effects. In some ways, they're not even that. They're the principal effects.
It's direct.
Yeah.
And again, even if this were economically neutral, but it's not, one would make the argument that the right thing to do for people is to give them a better, healthier life.
Yeah.
And to use, we had, in the hearing today, we had, someone suggest, well, all we need to do is do public service announcements. We'll just do education. And one of the experts says, quite accurately, that when you deal with an addiction, and we won't get into that today, but by the way, so just so everybody understands, it's now pretty clear from brain chemistry that sugar, and when we mean sugar, mostly it's fructose, because the other sugar is, cane sugar, which is sucrose, a combination of fructose and glucose. But fructose basically, that we understand that it is actually physically addictive in the brain because it results through the modifier of MGO, a chemical called MGO, which binds to receptors in the brain. It actually releases dopamine.
Yep.
Now, every single...
Would this explain my ice cream problem?
Well, it could. Every single addictive issue in front of us involves, and this is whether it's a addiction like opioid addiction, whether it's an addiction like sugar addiction or addiction like gambling, or take out your cell phones. The fact that our youth now spend 7 hours a day on a cell phone, on the internet and playing games and things, is because this is designed to release dopamine in the brain. So we understand the exact same mechanism. And it's up to us. And then the people will say, well, just educate, or government shouldn't be involved with this. Wait a minute. We're talking about regulating the industry for children with regards to apps. We're talking about regulating the opioid industry because it's addictive. We talk about dealing with gambling because it's addictive. Why wouldn't we talk about a food addiction that leads to misery and huge economic cost?
Well, but, Doctor, look, and this, my personal philosophy, I'm probably a little bit more libertarian here. Have what you want, but understand, A, should government finance things that make our population less healthy? Matter of fact, make many of them very, very, very sick. And the reality of it is when the majority of healthcare partially is financed in some fashion through government, we have an interest. And it's, in some ways it sickens me, but that's the reality we have to sort of mechanically deal with. And then the statistics, the data is just crashing on us since the pandemic. The curve of our brothers and sisters who are getting sicker and sicker, and now I'm dealing with, some of the data we're looking at of those moving into their retirement benefits being also much sicker, and trying to figure out how we finance that. And we're financing it with partially borrowed money. It's an honestly good economics and a moral argument. Maybe we should change the way we do nutrition assistance in America. Maybe we should change even down to some of the agricultural policy of adding more variety. And I've given presentations on concentration of certain crops and the whole way commodity pricing works. And the black swan theory of that level of concentration, God forbid something ever happened to one of the crops. But it all ties together. It is a unified theory. If I care about healthcare spending and understand, Obamacare was a financing bill. It was about who got subsidized and who had to pay. Our Republican alternative was a financing bill. We're right now doing the hardest thing possible in Congress. We're actually talking about what we pay for. Could we actually reduce healthcare spending by having a healthier country, a healthier population? And that would actually be much more egalitarian with prosperity.
Look, there's no question that's true. The fact is that we can send a strong economic signal through our ability to modify what is available under food programs, not only direct payments, but also the fact that we over the past 50 years, we've kind of funneled all the production, as you said, into only a handful of major crops. In my district, for instance, they used to grow tomatoes. It used to be one of the tomato capitals of the country. I didn't even know this, but it's not anymore. It's just soybeans and corn, partly because we have a big poultry industry. But the variety of crops has just disappeared.
So
and again, everything comes together and everything points in the same direction. We must address the obesity crisis. We know what causes it. We actually have a pretty good idea of how to solve it, how to get there. But we have to decide that that's something that we're going to do. And I think the average American understands it.
Oh, yeah.
I think they do.
No, it is fascinating. When I'm home in Arizona, the number of folks I walk up to and will almost pull me aside and say, I can't believe you were willing to talk about that. You told the truth. And it's almost like they weren't ready to have those of us from the political class do something that's uncomfortable. Let's say, but the math is the math. If you take a look at mortality statistics, is it moral to have a society, particularly working prime-age males? I mean, you were actually quoting some of the statistics in our previous conversation. They're dying younger and younger. What we've done to younger people in the country, what we're doing to seniors, we can fix this. We just got to be willing to do some difficult policy here. And it's not difficult policy. There's some experiments out there, and you and I have not talked about this before, so we're winging it, where it was the food box and saying, okay, we're actually going to deliver to our brothers and sisters who need nutrition support a box. And there was the problem. Sometimes the fruits and those things were thrown away, so they actually experimented with other ways to deliver them. It's in a microwave pouch. And it turns out it was working. And they actually were making people healthier. And then that pilot program disappeared. Look, we're talking billions and billions and billions of dollars, which means there'll be armies of lobbyists in the hallway here tomorrow really cranky about what we talked about. Can we make the argument we should do the right thing? And is this Republican or Democrat? It should be just the right thing.
That's right, and you bring up a good point. You know, the first thing you start with is say, look, we don't have to change this. Let's do a few pilot programs. Let's get some data, because otherwise it's incredibly difficult to see whether some of these ideas work to change the way people buy and their habits. And obviously, it'll take a generation for the obesity that already exists to plateau.
I'm more optimistic than you are.
Well, I mean, with Ozempic and Wegovy, maybe it's quicker, but these are not the solution. The solution is not to become obese and then take a drug to reduce the obesity. It's not to become obese in the first place. But your point is critical. Right now, a 3-year-old has a lower life expectancy than a 60-year-old had at the same age. That is, because our adults are getting these chronic diseases, they will actually, at an increasing rate, that 3-year-old, if we don't change the trajectory, will actually have a much less of a chance to live to the same age as their grandfather did or their father did. That is, we cannot accept that in America, that our children, we are in a situation where our children have a lower life expectancy than us. Oh my gosh. This is the opposite of everything anybody does anything for. As a father, you want to do everything for your children so they have it better than you. We're actually, kind of intentionally, because we intention how we spend dollars, we're actually forcing our children to a lower, shorter life expectancy than we had. Shame on us if we don't fix this.
Look, we're already crushing the next 3 generations. My wife's exactly my age, so I have an 8-year-old. I have a 23-month-old. Mathematically, my 23-month-old, when he is 20 years old, U.S. taxes will have to be double what they are today to maintain baseline services. This is what we're doing to our society. And we're coming behind these microphones and trying to say, we've done the economic presentations. Hey, we can do the Democrats' tax scheme. You get about 1.5% of GDP if you were able to tax maximize everything. For those of us who want to cut things, we get about a point of non-discretionary, discretionary non-defense. But that's, $300 billion there, if we could cut that much. Okay, so 2.5%. This year, this fiscal year so far, we were expected to borrow about 5.5% of GDP. We're closer to 9%. Does anyone see a math problem there? If this is everything, the political rhetoric of they want to raise taxes, we want to cut, and you only get this much, maybe we need to promote policies that disrupt the cost of government, the cost of health care. a couple weeks ago, I gave a series of presentations here of using technology, using AI, those things, to make government much, much smaller. We can do things like this. There are a path. Mr. Speaker Pro Tem, are we up against time?
Your time has expired.
Doctor, thank you for joining me. Mr. Speaker, with that, I yield back.
Do you have a motion?
Mr. Speaker, I would like to move that the House stand adjourned.
The question is on the motion to adjourn. Those in favor say